There once was a man named Clyde. His calf hurt with each single stride. He entered my clinic, ever a cynic, but left pain-free with me as his guide. Sometimes the presentation of sciatica can be singularly calf pain, and so that is the subject of this video. So how do you know if you have calf pain, if it's caused by something else like a strain to the muscle, or if it is sciatica, irritation from the nerve in the back that is causing your calf pain, or perhaps something else? That's what we're going to cover in this video. So let's talk about some theory first of all. So our spines are made up of vertebrae, and in the lower back, the lumbar spine, we have 5. Now in between each level, there is a nerve root that exits in the gap that is left between the two. And they are labelled. They are S1, L5, L4, L5, L3, L4, and so on, because that corresponds with the name of the vertebrae to the next one. Now, the reason why this is relevant is because certain levels supply certain areas of the leg. Now, the L4, L5 is a nerve root that supplies the calf muscle. Now, there is nuances with this. It's not absolutely clear cut, and you can get overlap between different nerve roots. But largely speaking, if we have a problem around the L4, L5 area, it often will supply pain into the calf muscle. So this is how you can have an irritation here that causes pain down the leg in specifically the calf. Now, you don't even have to have any pain in between the calf. It could be just the calf itself and no low back pain, but the problem could be coming directly from here. So how do you know if your pain is being caused by irritation of the nerve in the back that's causing pain in the calf, or whether you've got a localized problem in your calf? So sometimes this has been quite frustrating. Trying to work out where your pain is coming from can be really annoying because often it's not coming from where the actual problem is. Let me tell you a little bit about this real patient of mine and how he presented with calf pain, and he had absolutely no idea that it was actually coming from his back. Let me introduce you to somebody I will call Eddie. So I'm a real physiotherapist in a real clinic. This gentleman hobbled into my clinic, literally couldn't walk for more than a few steps, and it had come on over the last few weeks. Now it's characterized by no symptoms of sudden onset. There was no history of it suddenly going. It had just gradually come on. And the second thing is that when he sat down, the symptoms completely disappeared. But as soon as he stood up, within a few steps, he was really struggling to walk. There was acute sharp pain in the slightly outer side of his calf. And so here on the nerve diagram, we can see the nerve system coming all the way down the leg, and it's in this sort of area around his calf muscle, which he was experiencing lots of discomfort. So what are our alternatives when it comes to pain in the calf muscle? Well, we could have an injury to the muscle itself. This has usually got a history. You have done some activity. Maybe it's a bit out of the ordinary. You've perhaps jumped off something and landed, and that exerted the muscle in your calf that has caused it to be a slight tear and caused an irritation and therefore a pain in your calf. Now, with this gentleman, there was no history of that at all. It had just suddenly come on, which would be unusual for a calf muscle to present like that. Another thing is, of course, a more serious condition like a deep vein thrombosis, and they tend to present with a problem with huge amounts of swelling. Often redness and heat is accompanying it, and there's often a history, although not always, of perhaps post-surgery where it's been immobilized for a period of time, or say a long-haul flight, which again has been immobilized for a period of time. But again, with this particular gentleman, there was no swelling at all in the calf muscle when I compared one calf muscle to the other calf muscle. So although you can never completely rule these things out, so the presentation of it and the history of it meant it was highly unlikely that it was a more serious problem like a DVT. Finally, you've got things like peripheral neuropathy, which is where there's nerve problems in the peripheral nerves. And they just really tend to present with people who have other metabolic conditions like diabetes. The overriding symptom you tend to get with peripheral neuropathy would be more a numbness, a weakening type of presentation rather than pain itself. So we've got two potential likely diagnoses. One is that it's an irritation of nerve, and one is that it is a problem with the calf muscle. The best way to distinguish this is to actually do things that affect the pain if possible. So what I got him to do was I got him to get up and walk, and that produced his pain. Now, if we flexed his spine, if we bent his spine, the pain would reduce. And so what we did is we did some exercises working into what we call flexion, which is bending motions, and seeing then whether basically his calf muscle got any better or not. And fortunately, he was amazed to find out that within 10 minutes of doing a few repetitive mobilizations and exercises and a few stretches from myself, he was able to walk 50% better immediately than he was before. A confirmation to me that it's coming from his back. So therefore, irritation to the nerve, if it's coming from the back, then basically back movements will have an effect on reproducing or reducing that particular pain. If it had been a calf muscle problem, then basically it wouldn't have made any difference whatsoever. Okay, so let's talk about what I did with this particular individual, Eddie, who limped into my clinic, had pain in his calf. What exercises did I give him? So it's important to note that this might not be applicable to everybody because sciatica is caused by different things. But for Eddie, he was unable to lie down. It was too uncomfortable to lie down. The calf pain was really hurting. So therefore, I didn't really want to give him lying down exercises. So what we did is we started in sitting because sitting was really comfortable for him. And so in sitting, I got him to very simply just do some bending forwards at the waist with about a 5-second hold and then come back up. And we got him to do that 10 times. 10 times, 5 seconds, just reaching forwards in a sitting position. Perfectly comfortable. Now what this was doing, of course, was mobilizing and stretching out some of his tightness because his particular problem was related to stenotic changes, i.e. stiffness. He was about 70 years old. The other thing I got him to do was to turn his body round to one side. Now I say one side because when he turned to the other side, it was painful. And so therefore, it was bringing on his calf pain. I didn't want to do that. So what we did is we simply went round to one side and back to the middle, round to one side and back to the middle. And very simply to begin with, on the first few days, that is the only 2 exercises that I got him to do, but I got him to do them a lot, 5-6 times a day. And this helped to gradually reduce his pain so that eventually, after a few days, he was then able to start turning towards that painful side. It no longer was painful down the leg. So we continued with our forward bend motions and then added our side to side motions. Now, those alone were enough to reduce his pain by about 75% and increase his walking distance by about 30 yards. Now, that doesn't sound very much, but when his pain was so intense that he couldn't walk more than 5 yards, then that's quite a significant difference in just a few days. Now, as things progressed, we added some lying down exercises because he was then able to do it. We added some lying on his back and rolling his knees side to side. And there's some other videos that I'll link at the end which describe these exercises. But the point being is that always listen to your symptoms in your leg. Start with exercises that move you, that don't increase those leg symptoms. And then usually from doing those kind of activities, you can then start to move towards movements that used to be painful because things have settled down. So I hope that helps. He was magnificently better. He was completely cured. And I was very happy with that because that is what I am in the business of doing.